Hello and welcome from Karolinska Institutet, where we've just discovered who's been awarded the 2010 Nobel Prize in Physiology or Medicine. With me to discuss this prize is Professor Christer Höög, a member of the Nobel Prize Committee. Professor Höög, thank you very much for talking to us. Could we begin by you telling us who has received the 2010 Nobel Prize in Physiology or Medicine?
It was Robert Edwards.
And what did he receive the prize for?
He received the prize for the development of in vitro fertilization.
And in vitro fertilization is something that's touched the lives of many people, but for anyone who's not aware of what IVF or in vitro fertilization is, could you explain it in simple terms, please?
In vitro fertilization is a method through which egg can be fertilized outside the body and then returned to the woman. And then in the woman giving rise to a baby in a natural way.
And what was Robert Edwards' achievements in IVF therapy?
Well, he started to work on this in the late 1950s. And initially he was studying female and male germ cells in animals, trying to understand the reproduction process there. But already during the late 1950s he realized that much what he knew could perhaps be used to treat infertility in humans. So starting perhaps in the end of 1950s, he had a vision that he could use his knowledge and others' knowledge to transform this into a method to treat infertility. And the first thing he actually did was to find out how human oocytes could be matured in vitro. And during a 10-year period, he showed step by step that they could be matured in vitro. That is, you took out through a surgical procedure, you took out immature oocytes from the women, you let them mature in vitro, and in the end, you could give them sperm. And he could show, and he was the first to show, that you could actually in vitro fertilize those oocytes that had been matured in vitro outside the body. So at that time point, it was a major success. It happened in 1969. It was in media all over the world. It was a fantastic success in that sense. However, he also came to the realization that the in vitro matured oocyte was a bit fragile. So he decided to shift focus and he initiated collaboration with a very skilled obstetrician and gynecologist, Dr. Patrick Steptoe, that unfortunately died in 1988. And together with him, he were able to retrieve mature oocytes instead of immature oocytes. And having access to these mature oocytes, he could then start over again by in vitro fertilizing those in a cell culture dish. And then, in this particular case, he could see that they formed early embryos. And that was coming close to the end of his vision, because now, not a few years later, his method then resulted in the birth of the first IVF child, Louise Brown.
And when was that?
That was in 1978.
And so that was a great breakthrough. So where are we now with IVF therapy? How prevalent is it and how successful is it nowadays?
Depending on the country you look at, it varies from country to country how much IVF is used. But if you look in Western countries or in developed countries, between 1 to 5% of the children born are through IVF.
And so IVF is more of a clinical procedure, and traditionally, or more often than not, the Medicine Prize goes to more basic research. Where does IVF therapy fit within all the other prizes that have been awarded the Medicine Prize?
It's clearly a medicine prize, and it's clearly a clinical application. And if you look in the history, I would say that this is one of the first prizes awarded in the area of reproduction.
So it's a unique prize within all the prizes since 1901 that's received the Medicine Prize.
In that particular sense, looking into the particular areas, it is unique, yes, I would say so.
And of course, according to the stipulations of the prize, you could have given the prize to 2 or possibly 3 people. What was the case for awarding the prize to Robert Edwards only?
The reason was that he was the one that saw the possibility. He started this many years ago, and he had many collaborators throughout these years, but each of them helped him with a specific task. And in the end, it was really Edwards that came out as seeing the vision and making it happen.
And as you said earlier, the key work was done in the 1960s and the 1970s. And as you said, the first so-called test tube baby was born in 1978, which must make her over 30 years of age. So what was required for this prize to be sort of the most compelling choice this year, decades later in 2010?
Well, the reason why it was awarded this year is that it is a very particular case when there is a medical award, an achievement like this. You of course have to look into the effect of the children. And during the last years there have been several long-term follow-up studies of the health of these children, which have shown them to be healthy. Furthermore, a number of those IVF children have had kids of their own, and they are healthy, and they happened without IVF. So all these things coming together, in the end, it was felt that this is a prize that can be given without regrets.
And one other issue about IVF therapy from the very beginning was that there was a lot of ethical debate about the use of human embryos. Was the ethical issue something that the committee had to consider when awarding this prize?
It is true that it was a large ethical discussion during the 1970s, early 1980s, but those issues has been resolved when it comes to IVF itself, the basal technology of IVF. That is no longer, I think, debated in any country as a technique used. Then, of course, there are follow-up techniques based on IVF. Those could be more or less discussed in different societies in different countries, but this year's prize is awarded only for the core technology, IVF as such.
And one of those follow-up technologies that you briefly mentioned there is, of course, human embryonic stem cell research, which itself is an area of sort of considerable controversy now. In giving this prize to IVF therapy, is the Medicine Committee making a message about the use of human embryos in research?
Not at all, actually. We are only focusing on the IVF procedure, and in IVF, the embryo, which is dividing a few times and then return to the mother. We are not considering in any other aspect of the embryo in this prize.
Okay, my final question is, did you get a chance to speak to the laureate?
Not myself, no, but the secretary called this morning to them, and he discussed the fact that Bob had been awarded a prize with his wife, Ruth Fowler, who said she was very, very happy. And she was sure that Robert Edwards would be equally happy.
Well, thank you very much, Professor Höög. Okay. For more information about this year's prize, please visit nobelprize.org, where you can not only find official information, but you can also see an exclusive interview with the laureate and also send your own congratulatory message. You can also follow nobelprize.org on Facebook and Twitter to receive regular news updates and to join in the conversation. And for the first time this year, we're giving you the opportunity to submit your video question to this year's laureates on YouTube. Visit www.youtube.com/the Nobel Prize for further information. That's about all for this live webcast. Join us tomorrow when we'll be at the Royal Swedish Academy of Sciences and we'll discover who will receive the 2010 Nobel Prize in Physics. The announcement time is scheduled for 11:45 a.m. Central European Time. But for now, it's goodbye from all of us at nobelprize.org.